If we come to the microneedling radiofrequency, it's two technology, it's not one. It's the microneedling, which is an old technology in the cosmetic field, and also the radiofrequency. The microneedling, either with the derma ruler, with derma stamp, or with the derma pen. I don't know if it showed with our pictures like this, maybe better. Yeah. So we have all these devices for the microneedling. We know that these needles will create a very tiny injuries and two tiny wounds, and will aggravate having the wound healing process. So we will have a lot of the release of a lot of growth factors, including the transepidermal growth factors, alpha and beta, and vascular epidermal growth factors, and a lot of growth factors in the derms. And this will help to do a new collagenases and elastogenases and angiogenesis. So we will have a new vessels, new collagen, and a new elastin fibers. And this will give the skin to be more tight and more useful, and the collagen will be even more. This is for the microneedling. If we add the radiofrequency for the microneedling, so we will have the RF microneedling. So at the end of these needles, these devices, when these needles insert into our skin, it will emit the radiofrequency, so it will heat deep the derms and will give us the good effect that we really need. If we see here that these devices use a very tiny needles to puncture the skin, and this will create a physical action, the one we mentioned about the microneedling. And then we will have supercharged with the radiofrequency, will give us the electrothermal energy that we mentioned before. And this will be directly delivered to the derms, the papillary derms, and to the reticular derms to give us the effect for the dermal remodeling that we want. The interesting thing that these effects start directly after the session, and it does not stop after a few weeks or so. By many studies, the effect of the sessions of the microneedling radiofrequency continue until 6 months, and the improvement of the skin will still for 6 months. So it's really the result. We will not say that you will see it just directly. After 1 month, 2 months will be even more, 3 months will be even more. And sometimes if the skin is really tired and not tight, we give even more sessions. So the most common indication that we use for the microneedling is a skin rejuvenation, tightening, and wrinkle reduction, either for the face. Perioral area is very great indication, also for the perioral area and for the neck. There are many indications for the radiofrequency microneedling, especially for the open pores. We use a lot of peeling, sometimes fractional lasers, but for the microneedling radiofrequency devices, they give us a really great results. And after 1 week, the patient will come back to you telling you, I really love the tightening and the shining. My pores are most of it is closed. So the satisfaction rate of the oily skin and the open pores is high for these patients. Also, we can use it for all types of scars, acne scars or surgical scars, either by itself or combined with other treatment. For keloid, it's really also giving great results, but also we inject triamcinolone with it. I prefer that for the keloids, not radiofrequency alone. So the combination therapy in this cases is even better. For the stretch marks, it works really nicely, but it needs many sessions. There is also new indication for these devices for rosacea, for the broken capillaries, and also for pigmentation like melasma. It's not enough by itself. We need a combination therapy for melasma, but it works. Also, it used sometimes for androgenic alopecia. I use it for a few patients, but with a combination therapy. So there is many research about it, but for me, I usually mix it with other treatments, not alone. For the axillary hyperhidrosis, honestly, I just mentioned that to tell you that it is used there. There are many articles about that, but me, myself, I didn't use it for hyperhidrosis. For this indication, I didn't do it for my patient. Maybe you can try for your patient. It is there, and in all devices, the setting parameters is there, so maybe you want to use it, so we have to tell about that.